Greetings, everybody. Dr. Randy Wurts in Thrive Chiropractic. Hey, chances are if you're watching this, you're either pregnant, you just had a baby, a boy or a girl, or you may know somebody who is pregnant and you like to share this information with them. So, me and my wife just had a baby girl this past Monday, and the pregnancy went well, and the labor and delivery went well as well. So, but I would like to share with you some tips about what you can do to say, hey, maybe things didn't go well during my pregnancy and the labor and delivery didn't go quite as what we hoped for. And we see some things that just are not quite right with my baby, and there's some concerns there. So I want to share with you some tips about what you can do to either have a great pregnancy, delivery, and then what do you look for when you have maybe some issues with your baby. One key thing that you can look for. So throughout pregnancy, my wife was very good with her diet, make sure she got plenty of rest, drank lots of water, so nutrition is important, but she also had regular chiropractic care that she would get usually on a weekly basis. Now, I'm not saying you necessarily need weekly chiropractic care for you. I'm just saying that's what we chose to do. Obviously, it was cost effective for us, but you got to decide what works best for you and your health conditions too. So that helped move her hip. She was actually moving around much too. So during the course of delivery, we found a hospital and a nurse midwife that was very congruent with our philosophy. So make sure we do that. Allowing the birth to progress naturally is best of all, because you're not forcing some things to happen, and it puts less stress on the baby and mom too. So during delivery went great. So when you get adjusted during pregnancy, it helps the delivery. The research shows that it actually helps in the pregnancy, but also the delivery process significantly to decreasing the times and making it easier for mom and baby as well. But like we said, some things, baby doesn't always, things don't always go as planned. So I'm going to show you one simple thing and one simple thing that you can test on your child to make sure that, hey, stuff is right. So some tips that you know that maybe there are some issues or some injuries, maybe during birth, not intentional, things happen. It's definitely not intentional, but some things that you can look for. So if you see your baby holding their head to the right a little bit or to the left, they're just stuck in a certain position, or they're having a hard time nursing on a certain side, you can tell that, hey, this is something that's not quite right. If they seem rigid or their neck seems stiff, so their neck doesn't pull up, so they do a test at the hospital and want the neck to be nice and easy and loose. They can't hold their head up at the time, but if their neck is stiff, it says, hey, something's quite not right. Or if they're holding their arms close to their body, when you let them down, they should splay their arms out and grab, but they're not doing that, and they're holding their arms really close to their body. That's a sign that something's not quite right. So, obviously, if they're not eating well, they're fussy, they're crying all night. Now, I know the first couple nights adjusting to home life is not the easiest things. Trust me, I've lived it. My wife has definitely, God bless her heart, has definitely lived it. And kudos to all you moms who have done that before. But you know, after the first few days, baby should be getting used to some things right now. So if they're not going to the bathroom, that's a telltale sign too. So what I look for as a chiropractor, definitely with babies, is the upper neck. So upper neck has a lot of issues that can conspire to it. The head tilt. We want to look at the muscles in particular. So I'm going to show you something that you can look for when you are with your baby. You're suspecting that something's not quite right. Now, moms, always listen to your intuition. It is powerful at this point because you have that bond with your child. You know what's going on. Listen to that intuition. It's very important. Simple tests that you can do to check and see, hey, there might be something that's not quite right with my baby. It's actually you're going to use your hand. So what you're going to do is you want to take your hand and you want to feel this part of your hand, the thumb part right underneath, and it should feel nice and soft. With an open hand, nice and relaxed, it should feel soft. That is what your upper baby's neck should feel like, and through your baby's neck should feel like. Now, you start to go 1 degree more, take the pincher to this, like your finger, and you push on it. It's a little harder, okay? Not quite bad, but there is still a little bit of issues. Now we go to the next one. You see how it gets a little bit harder. We go to the next finger, definitely harder. This one, really, really hard, very severe, and that baby's not going to be either moving very well, it's going to be rigid, could have some definite issues. I've seen babies that come into my office like this. Usually we start seeing colic ear infection later on down the road. Even when one baby had failure to thrive, she was actually losing weight at 4 months of age. Mom didn't know what to do. So we see other kids that are vomiting, throwing up, reflux, just to name a few of those things. And that leads to problems later on in life. So I want to do that again. Make sure that baby's hands, our baby's neck is nice and soft. We don't want to see this. This is the next sign, or next sign, and it gets worse here out. So just a telltale sign to say, hey, something's not quite right with baby. But if you do have any questions, or if you know somebody that needs this video, please share it with them. Or you're not quite certain how to check for this, by all means, give us a call. We'd be happy to help. Just a quick screening, no charge at all, because we want to make sure that you're confident that your baby's going to have the best health right now, but also in the future. So I want you to share this with people too. You know somebody that's pregnant, maybe having a difficult time, or their baby's really fussy and they don't know where to turn, don't know what to look for. By all means, give us a call. I'd be happy to help screen them and pointing them in the right direction. If care belongs to here, if she belongs to here, I'll definitely let them know that. But if you refer to another provider or somebody else can help, I'll definitely point you in the right direction as well. Till then, I want you the very best. This is Dr. Randy Wurts in Thrive Chiropractic, and have a fabulous day. Bye-bye.